What are some common treatment approaches for feeding disorders in young children? There are several treatment approaches that can be used for feeding disorders in young children. The approach will depend on the underlying cause of the feeding disorder, the age of the child and the severity of the feeding difficulties. Some common treatment approaches include: first is feeding therapy. This is a type of therapy that is designed to help children develop better eating skills and overcome feeding difficulties. It may involve working with a pediatric feeding specialist who uses techniques such as food chaining, oral motor exercises and behavioral modification. Second is medical management. In some cases, feeding disorders may be caused by underlying medical conditions, such as reflux or food allergies. In these cases, medical management may be needed, such as medication to reduce acid reflux or a special formula. Third is behavioral intervention. Sometimes feeding difficulties are caused by behavioral issues, such as refusing to eat certain foods or throwing tantrums at mealtime. In these cases, behavioral intervention may be helpful, such as offering rewards for trying new foods or using positive reinforcement. Fourth is environmental changes. Some children may benefit from environmental modifications, such as limiting distractions during mealtime, establishing a consistent mealtime routine, and using adaptive equipment such as special spoons or cups. Fifth is nutritional support. Children with feeding difficulties may be at risk for nutritional deficiencies. Nutritional support may be needed to ensure that the child is receiving adequate nutrition. This may include supplements, special formulas, or feeding. Overall, the treatment approach will be tailored to each child's individual needs, and may involve a multidisciplinary team of specialists, such as a pediatrician feeding specialist, speech therapist or occupational therapist.